the problems have actually been exported to the developing world with outsourcing of manufacturing. So it's time that we got the brown agenda back onto the screen, and that's what Blacksmith has been working on. And it's been set up by our first speaker this afternoon, Richard Fuller. Richard is an Australian-American who started his working life with IBM Australia, then moved to the States and worked. His first taste, I think, of the environment was working as a consultant to UNDP in the Brazilian Amazon, trying to set up reserve parks there. Back in New York, he set up an environmental engineering consultancy firm, Great Forest, which did very well and continues to do well. But like a good citizen, he felt he should give something back to society, so he set up Blacksmith in 1999 to work on contaminated sites, one at a time. He found pretty soon that there were so many of them, and I think Blacksmith now works in over 40 countries. But basically, the problem was far too big for just little Blacksmith, so had to get everybody else on board. And he's been extremely successful doing that, and you'll hear about it this afternoon. He's been able to catalyze the establishment of a global effort, the Global Alliance on Health and Pollution. But it's a compelling story because in 10 years he's done tremendous things, and he tells it much better than I can do. So over to you, Richard.
Thank you, Karthi. Thank you all for coming out. Rowan, you want to on this one? Turn that off. How's that? Can we hear now? We've got my mic there. Wonderful. Thank you very much for coming out and talking. I'm very pleased to be here, and I'm talking about, of course, the subject that's very near and dear to my heart, which is pollution in general. Part of that is contaminated sites, but in fact pollution has a very broad impact on our lives, especially in the developing world. I'm going to show you why that statistic is true in a second. It's the single largest cause of death. It's bigger than road accidents, it's bigger than cancer, it's bigger than smoking, it's bigger than obesity, it's bigger than malaria by an order of 10, it's bigger than tuberculosis by a factor of 12, it's bigger than HIV and AIDS by a factor of 9. Here it is. This is WHO data, the numbers of deaths in millions in the world. The entire world in 2012 had 55 million deaths. Of that, almost 10 million were caused by pollution, whereas cancer is attributable to 7.5 million, tuberculosis, malaria, HIV, you can see all those around 1 million. Where did all those deaths come from in pollution? I'll show you. There are 4 or 5 key problems that are pollution issues in the world. Outdoor air, you all know too well. Delhi has recently claimed one of the top spots in terms of contaminated air. It's not alone. There's many, many cities throughout Asia that fit into that particular category. Indoor air, especially in rural areas from cooking stoves, those pollutants also are big-time killers. Contaminated sites, which I'll talk a lot more now. The conservative number puts the number of deaths at around 1 million. It's probably closer to 2 or 3. And sanitation also is a significant killer. And as it turns out also, especially in India, where sanitation issues seem to be among some of the worst in the world. Adding up all those figures comes up to that almost 10 million. I'd like to point out that high-income countries only have problems with outdoor air. All of the rest of these problems have trivial amounts of death associated with them. When you add it all up, this is the statistic I want you to go home with. 1 in every 7 deaths in the world is attributable to pollution. It's actually 1 in every 6.5. But this is a number that deserves our attention, something that we should be dealing with. One thing that you should also know, though, is pollution isn't actually a disease. You don't get pollution and get sick and die. Instead, pollution causes you to get diseases. It's called a risk factor in the World Health Organization parlance. So instead, when you're exposed to pollution, you're more likely to get a chest infection, or diarrhea, or cancer, or cardiovascular disease. And when you look at the deaths from pollution, the numbers are calculate it by looking at what are the additional deaths above the normal levels of those particular diseases. So when you're looking at deaths by cancer from pollution, you look at the normal background level of deaths by cancer, and then you add on to it the additional deaths that are caused because of exposure to toxins. So the Global Alliance has been formed in the last year or so specifically to try and deal with this issue. It's an international group with member countries and international agencies as its member. Its main responsibility in the world is with the World Bank, and the World Bank is funding it to move forward, and it has a trust fund that's been established. And it has a range of different partners, from the European Commission, the Germans, Inter-American Development Bank, UNDP, United Nations Environment Program, and then a bunch of different countries and their agencies. Asian Development Bank is also one of the founding members. In terms of member governments, here are some of them: Mexico, Ghana, Indonesia, Cameroon, Madagascar, so on and so forth. India's been invited, but India has been in the middle of rather turbulent election period, so they haven't paid too much attention to these issues. Let's let things settle down, and I hope that India will soon also join. And the purpose of this organization is to do three things. First is to get the message out. Here is a problem of scale which we've forgotten about. Karati put it very eloquently. The environmental attention now is on climate change and a little bit on biodiversity. We need to bring back that which kills 1 in every 6.5 people in the world. We should be thinking about this. I know you know this is the case because you live in places that are highly polluted. We've forgotten about it in the development agenda. It certainly needs to be there, but we also need to help and bring resources to all of these governments that have these issues to try and work with it. And that is part of our agenda. The Global Alliance will help to funnel and channel resources, especially technical assistance, to countries to solve specific problems related to this particular agenda. We also need to make sure that we're doing these projects and doing these things in a way where we're being very productive. So the Global Alliance has created a method of being able to measure projects. Let's say we want to change out all of the soot-belching buses in Kolkata. Let's calculate how many people are being affected by that, what the number of years of effective life are being lost. Let's measure that, let's do the work, and then measure it afterwards, and see how cost-effective that particular intervention was in terms of public health. And these are the three things that the Global Alliance is tasked to do. Now, because the Alliance has only started recently, it has only a small, modest budget, about a $5 million US budget at the moment. But it's doing a lot of project work around the world. Blacksmith Institute, the organization that I started in '99, is the secretariat helping to coordinate a lot of these projects. But a lot of them are also being done by member agencies like UNEP, World Bank, and countries who are members of the Alliance. And here in India, we're launching in partnership with CEEW and PHFI an initiative to help do this work here in India. This initiative will be able to provide policy advice and technical support like the Global Alliance, but at the local level here in India. I'll let CEEW talk a little bit more about that later on. Let me talk about how we've gone so far, where we're measuring ourselves with our performance in the last year and a half of activity. So first of all, in terms of raising awareness, at the international level, we put out a few reports. You can look at the website gahp.net and pull some of these up. The main thing that we've been doing has been to make sure that pollution is well represented in the Sustainable Development Goals. So you all may know that we had the MDGs. The MDGs are the Millennium Development Goals. They're expiring at the end of 2015. And a new set of goals are being created called the SDGs. There'll be 15 of these, and they'll set targets for performance in different areas related to health, education, and the like. Pollution was barely in it at all. And we've worked very hard to now have a line in the health agenda where pollution and a target specific to pollution is now being included. There's still another year and a half of negotiations to go, and I hope it can stay in, and we're working aggressively to make sure that it does. We're also putting out documentaries, we're talking to the press about the problem, we're trying to raise the broad agenda around this issue as much as we can. I can talk about the work that we're doing in countries to do projects to help countries work out how they can implement solutions to these problems. Most of that work focuses on contaminated sites and that particular aspect of the pollution agenda. There are 25 countries right now that have targeted programs, including India, and you can see the list there. It's countries from all parts of the world, from Central Asia through to Southeast Asia, China, Central America, and Africa. And different programs are going in different places, and I'll show you a few examples of these. The basic protocol and process that's followed in each of these countries is, first of all, to help the government by identifying the places that are highly contaminated, the places that are dangerous to live near, and then training the government in how to prioritize interventions, and then doing pilot projects to help to deal with those particular problems. It's a kind of a learn-by-doing mechanism in each of these countries that India has stepped through quite nicely so far. And it looks at toxic sites in each country according to some basic categories. Here are the 10 major problems that affect any particular country. Lead as a toxin is one of the most pernicious toxicants you can get. You can die from it at high doses, and there have been many cases of death from acute doses. But at low doses, in the background of a community, it causes intellectual impairment. You get a lot of people who are mildly mentally retarded. So as you reduce the IQ of a community, also you reduce their capacity for economic development. And you've ended up putting an economic cost on that community for an intolerable long period of time. So it's one of those silent, terrifying problems that we must be very vigilant about and measure and make sure we deal with as much as possible. Mercury, similarly, it also causes neurological damage. Not much of a mercury problem here in India, I'm happy to say. Most of the mercury exposures are being well dealt with. But chromium, especially hexavalent chromium, is one of your biggest problems. Hexavalent chromium is an acute carcinogen, causes all kinds of intestinal cancers as well as other effects, causes cardiovascular disease, and obviously it's associated with the tannery industry, for which India is justly famous. Other heavy metals like cadmium, arsenic show up sometimes in mines and other parts of the place. Pesticides, we know well that pesticides are problems. It's not nearly in terms of gross public health exposure as significant as these metals, but it certainly is a significant issue in its own right. We worry about chemical weapons, especially in the former Soviet Union. We worry about runoff from poorly managed industrial estates. I'm pleased to say that in India, a lot of attention has been given to industrial estates, and for the most part, over the last decade, they've improved substantially. And management of large companies within industrial estates is one of the success stories here in India. Hazardous waste dump sites, especially illegal hazardous waste dump sites. People that don't want to pay the fees to take things and will dump it down by the river. These cause terrible problems, usually with metals as well. E-waste is a small problem, but one that catches the public attention. Uranium processing, only a small problem here, very little in India, but many, many other parts around the world that are of issue. So we quantify these sites by measuring them, by visiting them. You can't see the outline very well, I'm afraid to say, but can you tell that South America on the left, in the middle is Africa? This is the African continent here. Here is India, Southeast Asia over here. These are all of the sites that the Global Alliance partners have visited and analyzed for toxicants, thanks so much, and looked at them and determined if they're dangerous or not. And by dangerous, we mean that there's a toxin that we know damages children at levels that far exceed the safe standards. The safe standards being set by the US or the Indian government or the European Union. Usually by far exceed, I mean at least 5 times In order for it to get a dot on that map, it has to satisfy that criteria of being a significant population, usually more than 500, and with a toxin being absorbed by that population at these dangerous levels. So there's 3,500 sites out there in that database with an affected population that we're projecting to be well in excess of 200 million people globally. And India's share of it looks like this. 420 sites, there's 7.5 million people impacted, but we're only measuring 420 sites. We suspect there's more likely to be 4,000, so this number is small. We calculated the burden of disease amongst the sites that we have measured, and it's easily larger than air pollution or malaria right now. So this contaminated site is an issue of quite substance here. And of course, the largest problems, as we talked, are chromium and lead and other heavy metals. And if you'll bear with me, I'll show you one of those sites in the database so you can get a sense of how this work goes. And cross your fingers that this will work. Good. So this is the database online. I couldn't get Wi-Fi on this machine, so I'm changing over to the other machine. This is the sign into the database looking at 3,500 sites. And here are the different countries for which this work has been done. You can see it's a pretty heavy list so far. There's about 85, 90 countries who are in that. If I look at one site here that I pulled up, here in Kolkata, that has lead poisoning, I want to show you what kind of information we're picking up on it. This is Picnic Gardens. It's in the northern part of Kolkata. Central part. There are half a dozen lead smelters there who are extremely toxic, who have spread their effluent all through the community. And we are measuring an affected population, which I can use this machine here, like this. We're measuring an affected population of 30,000 people who are taking in soil that measures at 30,000 ppm when the level should be at 400 ppm. So that is a large affected population that's going to be mostly children. We collect quite a bit of data on this, and let me see, see now this machine has, there we are. We collect quite a bit of data. There's quite a lot of technical details and descriptions of the site are listed in here. Its location is graphed, and a whole set of data and information about the site is collected. And we also collect information on who are the key people involved in it. What are the main stakeholders who are involved in it? Who are the government officials, the NGOs, the health officials who are dealing with this particular issue. And finally, we look at anything that has already been done related to the site. We collect media reports, we collect technical reports, we do photos of the site. These are lead batteries that are lying around in an abandoned area next to one of the canals. The lead levels around this area will be very high. So it takes about a day for us to do these analyses. It gives us a quick snapshot of a place that's acutely toxic. And that information we can then bring back both to the Tamil Nadu Pollution Control Authorities and to MOEF, who own this database now, by the way. CPCB owns this database, so that they can begin to prioritize interventions and work towards strategic solutions for the whole of the country. And let me tell you how that's been going to date. And I think the first thing we have to do is we have to acknowledge our other guest here for being the critical developer of the main response that's happening right now. Jairam Ramesh was clever enough to include in the Clean Air Fund an ability to spend money on toxic contaminated sites cleanup. And some small funding from ADB and more money from the World Bank has helped to create this data board. And that says a lot. We are doing this work in 50 countries. There's only 2 that have started to do anything about it in India. So I'm really happy to see that having moved forward and the beginnings of some work to deal with this appropriately. I can give you a little bit of a flavor of how these things get solved and the kind of pilot projects that we've been implementing at different times around the world. I don't have an India example here, but I can show you some examples in other countries. Here was a cleanup where 18 children died from lead poisoning from batteries, just like Picnic Garden. They died because they were playing in areas right next to these wastes. They took in too much of the material and it killed them. Came in and cleaned it up. It cost a couple $100,000, removed all the contaminated soil, put it into a landfill, buried it deep inside of a municipal waste, and have been helping the community since then to move forward. We're also doing projects related to mercury in Bolivia, Indonesia, the Philippines. So instead of mining for gold and using mercury and releasing that mercury into the environment, we're teaching them how to use mercury-free techniques so they're no longer exposing themselves and their children to mercury. We've done emergency projects. We had 450 children who died from lead poisoning, again associated with gold mining in a rural part of Nigeria. And we came in and cleaned that particular problem up as part of an emergency response. Their local religious leader, the emir, what's the name of the Muslim religious leader in Nigeria? I've forgotten the title. The emir had encouraged them to bring home ore from a new mine that had opened up and process it in their houses. And they would process it for gold using their kitchen implements. And the ore, unfortunately, was also 15% pure lead. So after they'd extracted gold, they would throw that residual into the backyard where their children were playing. All this happened quite rapidly. All of a sudden, these little villages started processing this ore to make money for themselves. And when the World Health Organization sent a group called MSF, Medicine Sans Frontières, out to go and vaccinate children through this region, they came across these towns and there were no children to vaccinate. There were just rows and rows of little graves because the children are acutely exposed to this, and there were just hundreds of them that had died. So it was an emergency response to clean this up. Other projects, here's a pesticides cleanup in Somaliland of all places. It's pesticides right next to a refugee camp where there's about 85,000 people who are being exposed to diodrin and aldrin, and so on. These things are going on too. Sorry that this is such a depressing kind of presentation, but we have to do it. So, let me talk a little bit about where this moves forward. There's also work that we're doing in setting up objectives and measurement systems to monitor projects. And we do this based on health outcomes. The World Health Organization has a mechanism called a disability-adjusted life year, which is a year of life that's lost because you're either sick or you're dead. And you can use that particular metric to measure the efficacy of projects by looking to see how much disease there is before you do the project and then how much afterwards, and then calculating how many disability-adjusted life years have been saved. And this is exactly the same metric that people use for other health interventions like malaria or HIV. And it's a metric that we'll bring into this particular community. Moving forward, the Global Alliance has a strong future, has some very strong supporters. We're planning to move this into an organization that is similar to the Global Fund, for those of you who are in public health. The Global Fund deals with HIV and tuberculosis and malaria, or Gavi, which is the Global Association for Vaccinations and Immunizations. So we're planning on doing this and moving forward as far as we go. But I think what's more interesting is to think about where India might go in all of this. We've talked about a couple of these things. We think that the government of India should join this alliance and bring its voice into this particular issue. But also, we're looking forward to beginning the work here in a similar fashion with an Indian association with our partners CEEW and the Public Health Fund of India. We also think that there needs to be work done on outdoor air. And the urban air problem here is acute, it's getting worse. And there needs to be some solid thinking on what are the most cost-effective and useful things to be done to deal with outdoor air. on a city-by-city basis. Not only on a national basis, but on a city-by-city basis. And I think there should be more attention in that area. And what I think also is critical in all this is that we have to do this together. There needs to be just as much a corporate response to this as a government response. And I think bringing those partnerships together in this very thriving area will bring a lot of results. So there's my brief summary, what's going on in the world and what's going on in India. I'll pass it back to Karati and then look forward to any questions you might have later on.
Thanks, Richard, for that depressing presentation. I hope he's stimulated your minds and you have lots of questions, but hold them for the moment because we need to hear from our next speaker, who I'm sure doesn't need any introduction to an audience such as this. So let me just tell you about the connections that I have with Jairam. He's a dear friend, and we actually go back a long way to the 1980s when he was in the Ministry of Industry and I was in the Ministry of Commerce in Yojana Bhavan, and we were lunch club mates. I recently discovered that I have another connection with him. We both attended St. Xavier's in Ranchi. And a little bird tells me that he's probably about to publish a book on ecology and the economy. And I'm hoping that at least that publication will present a powerful argument for the agenda that we're trying to promote today, and therefore it gives me a lot of pleasure to ask Jairam to address us. Jairam?
A very important but neglected issue in India, the linkage between environment and public health. For too long in this country, environmental issues have been seen to be elitist, middle class, lifestyle issues. But in reality, environmental issues in India are fundamentally livelihood issues. Unlike in the West, where it's the preservation of lifestyles which is at stake, in India, it's the sustainability of livelihoods that is at stake. So when we read about environmental issues, we don't normally look at them as issues of access to water, access to land, access to forests. And much of the agitation that you see in our country, which go in the rubric of what is considered to be environment growth debate, are basically issues of people agitating for control over their own land, control over their own water sources, control over access to forests, control over cultural traditions, and so on. The bauxite mining issue in Niyamgiri Hills was basically an issue of the control of the Dongariyakon tribal community over their cultural traditions. The POSCO agitation in Odisha was basically an agitation of local villagers not wanting to part with their land in spite of the compensation that was being given. The Chipko agitation in Uttarakhand many decades ago was the agitation of women against the felling of trees by rapacious contractors. The agitation against the Jaitapur nuclear power plant in Maharashtra was basically an agitation by fishermen afraid that this would cut into their livelihood options. So actually, when you look at the environmental issues today all over India, I think while it is true that environment and growth must be integrated because we can't do without growth, but the preservation of the environment is not a luxury. The preservation of the environment is actually a necessity. The grow now, pay later model, which all countries have adopted, is not a luxury that we can adopt. So we really have to find our own solutions. And in the search for these solutions, the first recognition must come that the environmental issues today are fundamentally issues of livelihood of millions of people, struggling to maintain control over their land, water and forest resources. The second dimension of environment, which is not recognized enough in this country, is the public health dimension. That increasingly, in terms of incidence of asthma or cardiovascular diseases, or in terms of exposure to chemical contaminants or carcinogenic chemicals, chromium, lead, mercury, name it, volatile organic compounds. Increasingly, people are being exposed to a degree of pollution and contamination which is beginning to have very serious public health impacts. The area where I grew up close by in Bombay. And Chembur is an area which is full of fertilizer plants, refineries, power plants and so on. And some local political activists belonging to different political parties came to meet me and said that there is an alarming incidence of cancer amongst children. Something that completely foxed me. And then when I did some digging around, it turned out to be true. And a local citizens had called a bandh when I visited, not to protest against my coming, but to felicitate me on my going there, because they wanted to tell me that the incidence of asthma is very, very high. Main centers for pollution. The point I want to make is that if pollution is an inevitable price we pay for prosperity, pollution is beginning to have very serious public health impacts. And it's not just air pollution, it's water pollution. In fact, most of our public health concerns come from drinking water and sanitation. We want infrastructure. If we just invest 1/10 of that amount in clean water and sanitation, we will have a much greater impact on public health situation. All the great mortality declines in Western countries took place much before advances in medical technology. It took place because of the supply of safe drinking water and safe sanitation. So the second dimension which I want to highlight, livelihood issue, not a lifestyle issue. Second, that environment is not a luxury issue, but it's a day-to-day public health issue which is having an impact on morbidity and mortality, both. We saw some figures that Richard pointed out. And the Public Health Foundation has some numbers which they have put out as well. So both in terms of morbidity impact and mortality impact. So I think the initiative that we are discussing today, which is what do we do about toxic pollution? What do we do about the preponderance of locations in our country which have some 400 odd locations that Richard had pointed out, and those are actually locations which have been studied. There are many other locations which are contaminated. The map of India, and I find 5 different diagnostics for contaminated sites. The first is where waste is dumped. You saw batteries being dumped, or hazardous waste being dumped, or e-waste being dumped. And those are the 400 sites that Richard, 400 odd sites that Richard is referring to. The waste dump sites, where you would actually dump industrial waste or chemical. Many other sites which are chemically contaminated, which are not part of Richard's number or Richard's map. And let me suggest to you the 4 more additional diagnostics. Fly ash sites in India are very, very serious public health hazards. We produce between 100 and 125 million tons of fly ash every year. The more coal we produce, the more fly ash we produce. Because our coal is almost, it's really almost 50% ash. And the way we dump our coal is very hazardous. It's very land intensive, so we take a lot of land, we do fly ash disposal, It leads into run through of the chemical hazards into farmers' fields. It's a public health hazard because it's open. And as I said, the quantity is increasing year after are very, very important sources of chemical pollution. A third area is manufacturing sites, where you're actually doing manufacturing, where you have fertilizer plants, where you have chemical refineries, where you have pesticide manufacturing plants. These are all areas where, or you have leather tanneries, where you have sources of chemical pollution. These are manufacturing sites, and where the concern for effluent control is not very significant, and therefore the manufacturing site itself emerges as a major source of contamination. And the most vivid and the most tragic example of this, of course, was the Union Carbide plant in Bhopal, which even after 30 years remains probably amongst the most contaminated sites in our country. Chemical manufacturing sites. Fourth, and again not very well appreciated in our country, are the mine sites that have been mined and that have not been reclaimed or rehabilitated. Unlike many countries like the United States or Germany, we don't reclaim mining sites. We just strip the area of its iron ore or uranium or coal, and we don't restore those sites to their original condition or give it back to their original owners. They are left as they are, and they turn out actually to be very hazardous to the environment and to the community around. And the fifth area of contamination are the large tracts of land used as sanitary landfills in a most unhygienic manner, which really lead to chemical contamination. Now, so the number of sites must be running into thousands if you were to do a actual numbering of all these 5 categories. But Richard has provided a good starting point for us, and there are about 400 odd sites where you can say these are 47 sites are in Andhra. West Bengal has about 27 of these sites. So most states have very large concentrations of these hazardous waste or toxic pollutant sites. And some years ago, 4 years ago, when I was the Minister for Environment, I persuaded the then Finance Minister, Mr. Pranab Mukherjee, to announce the establishment of a National Clean Energy Fund. Now, what the Clean Energy Fund does, it was announced in the budget of 2010, it imposes a tax of 50 rupees per ton of coal produced in India. Either indigenously produced coal or imported coal attracts a cess of 50 rupees per ton. And this money then is deposited into a National Clean Energy Fund, and that National Clean Energy Fund is supposed to do clean energy projects. We've got about 10,000 crores already now in the National Clean Energy Fund, of which less than 5,000 crores has actually been committed. And 5,000 crores has not been committed. 200 crores for remediation of these contaminated sites. And in the first phase, we took 6 sites in Andhra Pradesh and 4 sites in West Bengal, 10 sites in all. And the idea was that we will gain experience with alternative methods of remediation, whether it was bioremediation or chemical remediation, and then move on and then deal with all the other sites. Visually, all of us know the extent to which chemical contamination and toxic pollution is affecting not just our air, also our water and also our land. In fact, many of our water bodies have become sites of chemical contamination. And I don't have to mention this in West Bengal, because West Bengal has one of the largest numbers of water bodies, and each water body is a stink hole. I just failed to understand for the last 30 years. This has bothered me that these water bodies, nobody bothers about cleaning these water bodies. Once upon a time, these water bodies must have been sources of drinking water or providing community water supply. But today, every water body in West Bengal, not only in West Bengal, every water body in India virtually is a site of water hyacinth. And apart from water hyacinth, all the chemical sludge gets deposited into these water bodies, and they become public health hazards. So I think we must take this up as a public health issue, not just as an environmental issue, because I know the moment you make any issue an environmental issue, then all the pink newspapers and all the GDP growth walas and all the CIIs and the fickies, become allergic, because they think that this environment issue is some bogus issue designed to keep India in a state of perpetual poverty and backwardness. So nobody wants to have sick children. I think the packaging of what we are doing is very significant. The packaging of what we are doing is that we are actually wanting to provide for clean air, clean water, clean land, better quality of life, better sanitation practices, better hygiene, so that ultimately the public health impact, the morbidity, mortality, the DALY figures give this their full backing. I think India should be part of the Global Alliance. I see no reason why India should not join the other 25 or 26 countries and provide a global leadership in this area. We have, in many parts I have seen, we have good technology available. Bioremediation is one. Rivers have become sewers, actually. We no longer have rivers in India, we have sewers. The Ganga is a giant sewer, the Yamuna is an even bigger sewer. Most of our rivers, most of our major rivers, and the holier they are, the dirtier they are. And we just don't seem to care about the quality of our rivers. And about 70% of this is because of municipal sewage going in, and 30% is because of what Richard has pointed out, the industrial pollution, the chemical contamination, the toxic waste that gets simply disgorged into these rivers. And Kanpur is a classic example of what happens when the leather tannery waste goes straight into the Ganga. In fact, if you look at the Ganga, which is now very much in the news, on a 2,500 kilometer main stem of the Ganga, about a 700 kilometer stretch between Kannauj and Varanasi is the most polluted, and that's polluted because of the pollution that is going in, apart from municipal sewage, from sugar mills, from distilleries, you name it, and they all send it into the rivers. We have standards. Those standards are never, we have rules, we have Section 5 of the Environment Protection Act, which is never invoked by any state pollution control board or the central pollution control board. So we have the regulatory apparatus to deal with this. But I think we need to deal with this rivers issue in addition to the chemical sites that Richard has pointed out, Bihar, West Bengal and Jharkhand. And a large part of our investment went into creating sewage treatment plants, but it's not just sewage treatment, it's catchment area, it's riverfront development, of which actually West Bengal is one good example of what they have been able to do in riverfront development of the Ganga. So these are some initial thoughts I had, and I want to congratulate you. And I think this is an issue that should not be seen just as a government initiative. It's really an initiative of civil society. It's an initiative in which the public must come forward, because ultimately it's public health that is being impacted by the manner. I'm sure that in the years to come, as we grow faster, this problem is not going to recede in importance. It's actually going to increase, and therefore the way we manage it now is going to be very crucial. Thank you.